on behalf of your executive team and the board, to the people who give to the foundation, what is one message you'd like to give to the community?
Thank you.
Hey everybody, it's BJ Murphy, and I have the honor and privilege. We are at UNC Health Lenoir, and I am here with the CEO of UNC Health Lenoir, Dr. Crystal Hayden. Dr. Hayden, thank you for joining us today.
Thank you.
So you have been here now, in May will be 3 years.
Yes, sir.
What has been the thing you've enjoyed the most about the Kinston community and this hospital?
I would say definitely, without a doubt, just getting to know the team, getting to know the community. It's such a sweet, genuine community. People are thankful and grateful for the care they receive and for having the hospital in the community. And just being embraced by the community and the team has just been wonderful.
Yeah, it's a special locally governed community hospital, not-for-profit hospital. It's got a unique relationship with UNC Health, UNC Health system.
Yes, sir.
Tell us about that and some of the advantages that come along with being a part of the UNC Health system.
Sure. So we are currently a managed entity, and that means that we have local governance, as you said. We have a 15-member board of directors, all reside in and around Lenoir County. And Kinston specifically, and we are able to have that local governance and make local decisions, but we have the depth of the system behind us from a resource perspective. So things like supply chain negotiation, payer contracting, specialty services to an extent. One of the biggest things that we've been able to take advantage of by being a part of the system that we would not have been able to do on our own is the implementation of Epic as our electronic health record. Epic is a premier tool, and a lot of rural community hospitals are not able to use it because it can be cost prohibitive.
Right.
But because of our relationship with the system, and the negotiations that occurred there and the licensing that occurred as part of being with the system, we were able to implement that. So that's just one example.
And I know the hospital's made great strides recently with new technologies. I know that we've been able to see behind the scenes on the new Da Vinci. You've got a cath lab that's coming. I know we're going to go see that in just a little bit. Tell us about the investment in technology and why that's important to rural Eastern North Carolina.
Sure. So as you can imagine, technology is being woven into the standards of everyday living, whether it's your smartphone or it's ChatGPT or it's some other form of artificial intelligence and technology as a whole. And so our philosophy is that you don't not get to partake in that technology simply because of where you happen to live or reside.
Right.
And as technology becomes standard of care for different specialties and different procedures, then it's our responsibility to provide that standard of care to our patients in our community. So things like the upgraded cath lab, the Da Vinci surgical robot, those things are very much standards of care, and you have physicians who are coming out of training that trained on those elements. So it's not cutting edge as much anymore as an expected standard, and so it's our responsibility to invest in that and bring that to the community.
And the hospitals recently got some pretty neat accolades. I mean, as a citizen or resident, tell me what Leapfrog is and what Leapfrog A and what being one of the top Leapfrog hospitals in the state of North Carolina, what that means to this team here, to you personally, and to our community at large.
It's really a reflection of all of the great work that the team is doing here. Do we get it right every single time? No. We are not perfect, but we are pursuing excellence every single day. And so the Leapfrog A, as an example, is a publicly reported grade that is assigned by a third party that has no real connection to UNC or to Lenoir or to any healthcare system specifically in the country. And they look at process measures and outcome measures. So do you have the processes in place to deliver high quality care, and do your outcomes prove it?
Right.
And they then, after reviewing that data, assign a grade of A, B, C, D, or F, just like elementary school, high
Right.
school. And obviously you want to be an A. Bs are strong. Bs are really good, strong hospitals. Cs are average, just
Right.
like in school. Well, we believe we're an above average hospital, and that Leapfrog A grade was testament to that and was reflective of all of the hard work that the team has done here over the last several years. When you talk about the top rural hospital designation from Leapfrog, there are a few other elements that are taken into consideration. One of them is not just do you have the processes in place and are you experiencing the outcomes, but it also looks at how much have you improved over what period of time, and is the overall mortality supportive of your positive outcomes. And that was quite a surprise. We did not expect, not because we didn't know we were doing good work, but just because those formulas are kind of top secret and you don't know exactly how Leapfrog is going to do all of those calculations. And so that was a surprise for us.
I'm curious, do they actually interview staff members as part of this, or they just
do
look
not.
at all the metrics and the data? Do they do an on-site visit or anything as well?
They do not. They
Okay.
look at publicly reported data, data that CMS has, and then we have to fill out an application, and it is probably about 60 or 100 pages.
Oh, wow.
And we have to supply very specific objective data. It is not subjective. It is not, do you think you're doing a good job? It is, tell us how you do X, or give us the volume of general surgery cases you did in calendar year 25. And so it is not subjective. It is very objective data that can be measured and replicated and measured, and they take all of that and look at it. And so the top rural hospital, we are the only one that received that designation this year
Wow.
in the state of North Carolina, and I believe there were 16 in the country.
Wow, that's
So-
huge. And how did the executive team and your management team react to this news?
There was a lot of smiles and shouts of joy and celebration, and then we immediately turned to how do we share this information and celebrate with the staff and the leaders
Right.
that are really doing the day-to-day work at the patient level and interacting with our patients. And so we did a few things. We did, the senior team served breakfast to the entire hospital.
Right.
We did some banners, we did some fun announcements. We did some meetings with key stakeholders and just tried to really accept it as a leadership team, but then immediately pivot and how do we share it with everybody else in the organization.
And I know it's a high honor, and I know you're excited, but there's always room for improvement. And the hospital has been really big on the 4 pillars. I know as a board and your executive team have really talked about that a lot. Tell us about what the 4 pillars mean to the team and what's happened over the last 3 years since you've been here, and what do you hope to see? What does that mean to the patient and the families?
Right. So the strategic plan that we rolled out in January of 24 has the 4 pillars, and it was optimizing service lines, improving ED operations and throughput, enhancing quality in both care and workforce development, and reestablishing trust and relationship with the community. And those 4 pillars continue to drive our work every day. As an example, we saw a change in ED provider group in October, and there has been significant work on improving the operations, the throughput, the patient experience of those citizens who come to the emergency department. We also see in optimizing our service lines, we have had some really successful recruitment efforts over the last 2 years, and we are really excited to see our medical staff grow and the specialties that we're able to offer expand. And then the quality pillar kind of speaks for itself with Leapfrog and CMS star ratings and the top rural hospital. And then all of that is the platform that we want to stand on to rebuild that trust and relationship with our community, that you can come here and receive great care. You don't have to leave. You don't have to travel. Again, we are not perfect. We don't claim to be, but we want to provide exceptional care every single time you walk through the doors. And that is our intent, and that is what we endeavor to do. And where we fall short, we need our patients and our community and our staff members and our family members to tell us so that we can continue this journey of improvement.
When I was in business school at East Carolina, we talked about this. It was a Japanese saying, Kaizen. It was continuous improvement. And I know for the hospital, that is something that's part of your daily ritual here, but also in terms of the types of care, the Da Vinci machine, for example, and who provides that care. Tell me a little bit about your role or the team that's here that's recruiting doctors, to what types of doctors you've been able to land, what types of practices they have, and maybe some of how that impacts rural Eastern North Carolina.
So we have a singular physician recruiter, Beverly Jenkins. She does a great job, and we involve all stakeholders. So when we are interviewing a physician candidate to come to town, certainly there's the formal interview, hospital tour, a tour of their clinic space where they're going to be spending their outpatient time. And then we try to include members of the medical staff that will be their peer group. So similar ages, are there young children in the house? What are their hobbies? How can we support those hobbies? Because it's all about recruiting the whole candidate, not just the physician part of the candidate.
Right.
And when you talk about the whole candidate, it naturally includes wife, kids, spouses, family members, in-laws, whoever might be coming with that candidate. And when you have a core group of medical staff that have really embraced that approach to recruitment, and they feel like they are recruiting their peers to come into the organization, it really has proven to be quite successful. And then we also provide time with the senior executive team, with frontline leaders. If it's a surgeon, not only do they get a tour of the hospital, but they get a tour of the OR. They meet the OR leadership. They talk to anesthesia. And so how can we, as comprehensively as possible, provide an interview and a site visit experience that really paints a picture for them of the team that they're joining and of the culture that we're trying to build. So under the optimizing service lines, as an example, we have had some successful physician recruitment, and specifically we've been able to recruit new providers into our general surgery practice, orthopedic practice, pulmonology, and GI. And those are services that have either been a little fragile in the community or didn't exist, as in the case of GI and hospital coverage. Obviously, there was outpatient community coverage, and so we're really excited to see those services mature and become a little bit more robust.
Right.
And we're very thankful for that.
In thinking of your relationships with the community, because this is a local organization, and one of the stakeholders in our community is this organization, the hospital. Another one is Lenoir Community College. Tell us, I know before you talked about your relationship with the college, tell us a little bit about what that relationship is today and how important the college is to what the hospital does every day.
The college is supremely important in helping to provide our workforce. And they have a variety of programs that students can go through, graduate, and come to work the next day at the hospital. And we really see them as a partner in advancing the workforce of Lenoir County and offering good paying jobs to local residents, and just seeing that younger generation and that non-traditional college generation sometimes just really succeed and blossom. As an example, we've created a nursing scholarship program with the college, and we offer several scholarships every year, and it covers tuition, books, fees, and a monthly stipend. And in exchange for that, there is a work-back commitment to the hospital. And so we've been able to bring on several new nurses through that program, and we offer it every single year. And we just really look forward to how that is an investment in the community and an investment in the future of healthcare here in Kinston.
On a personal note, I know North Lenoir High School has a nursing program, and my daughter's a senior. Two of her classes were this past semester were in nursing, so she actually came here to the hospital, did clinicals 2, 3, 4 times a week, had to get up extra early to, you know, to do, got her scrubs, and I thought it was a great experience for her, working with patients, cleaning them, bathing them, helping the nursing staff. It was just a great experience for the youth, and I know that program's been going on for a while, so it seems like it was a really really beneficial for her and her classmates.
And I think those health science academies are so important to our high school students as they start to figure out where they want to go to school, whether it's a certificate program, a licensing program, a 4-year degree. And we will, in the future, try to pursue more intentional relationships, not only at the high school level, but also reaching into middle school and really showing kids what options are. It's not just a nurse or a doctor.
Right.
There are so many different professions that the hospital employs and that are critical to us delivering the care that we do.
So, Dr. Hayden, we're now in the cath lab. Tell us what the cath lab is, what it's for, and what is some of this technology we see behind us?
Yes, so the cath lab is short for cardiac catheterization lab, and this is the patient table and imaging system where a patient would be laying on the table, and we feed a small catheter into the patient either through the groin or the wrist, and we are able to visualize the blood vessels in the heart and identify if there are blockages that are there that might be causing symptoms, or might be there, not be causing symptoms, but still be problematic.
Right.
And then our interventional cardiologist, Dr. Simpson, can deploy a stent, and that's like a mesh bridge, if you will, that can open up that blockage and keep it open.
Right.
And so that's what this equipment here is for.
So this is just for the imaging part, not the surgery if you need it, or
So deploying the stent is actually done with that catheter that's in place, that's allowing you to visualize, and is done here in this lab on this table.
Awesome.
If a patient would need a bypass surgery, then that's obviously something that we would not do here, and we would refer them to a different facility for that.
What has been the thing that maybe surprised you the most in your first 3 years here, being a CEO? Because you've got a background in nursing and operations management. What was some of the things that surprised you your first 3 years? What's been something that also has excited you the most about this hospital and the people?
Something that's excited me the most has been the willingness to say, yes, okay, let's try that. And the willingness to kind of step out and take a little bit of risk, and using failure as a launch pad for the next improvement. And we call that failing forward. And it's okay to fail. People do it every single day. But what's important is that you learn lessons from that, and you use it to move yourself, your department, and your organization forward. And so the willingness to embrace that has been very exciting, because you don't experience that everywhere, as you can imagine.
Right.
It's a willingness to change and to understand that not all change is going to be easy or seamless. And so that's been really exciting. What has surprised me? That's a really good question. I can't think of any.
Because you seem like somebody who is well educated, understands leadership, understands medical science and terminology and all the things, but also seems like somebody who has her day organized, understands what time it is and where she needs to be. So it's like most of the things you've probably planned for. So there's got to be something that you didn't expect to happen that has happened, good or bad.
Yeah. That happens every day.
Uh-huh.
And so I guess maybe I thought being a CEO, I would have fewer surprises. And I think I actually have more. And that probably has been a surprise. And how do you pivot from where you thought your day was going to go to where your day now needs to go?
Right.
And that's an element of leadership, right? We address that and we do those things every day. But I thought perhaps those surprises might be a little less, but I actually think that they're more.
And tell me about the team that surrounds you, the culture here, because every time we come into the hospital and I see maybe some of your leadership team leaving a meeting that you have, it seems like people are smiling and people are excited about coming to work.
So a few things that we do, we start pretty much every meeting with appreciation, and anybody can share it. So it's a job well done. Thank you, BJ, for coming and spending some time with us today. But it's generated amongst the team, and we start every meeting that way. And when you're practicing gratitude, it's really difficult to then pivot and complain or commiserate on what might not be going so well. And it sets you up to be in a much more problem-solving frame of mind than a problem-celebrating frame of mind. So that's one thing that we do. We also, to the extent that it is appropriate, we are very transparent with information and communication. And what I know, the rest of the senior team knows, the frontline leadership knows, and the frontline staff know. We do 4 or 5 times a year conversations with me and frontline staff where 10 to 15 frontline staff are invited to have breakfast or lunch, and we just talk about what's going on. What are your frustrations? What can we as a leadership team do better to support you as a frontline employee? And the engagement with those groups is wonderful and really gives us insight into what are their pain points every day. And so how can we then take that back to problem solving and making their workplace a easier and a more pleasant place to work?
Why is it that having a strong hospital in rural North Carolina is so important?
Our patients and our community deserve it, first and foremost. Secondly, we know that Eastern North Carolina is spread out. There's a lot of geography, and it can be very taxing and limiting for patients to have to travel for health care.
Right.
And so keeping local care local and doing it in a high quality, exceptional way allows our patients to stay healthy, improve their health, receive the care that they need, and not have the burden and stress of having to travel to get it, which just compounds their health issues. They're more likely to delay seeking care, which then becomes more expensive and more specialized care. And so really having a fundamental, strong healthcare system in a community positively impacts jobs, the community's health, the perception of those wanting to invest in the community as they're looking for infrastructure for employees they may be bringing into the community. And so it becomes important on a lot of different levels.
And the last thing, because we could talk about the hyperbaric chamber, the Da Vinci, this cath lab. Most people, when they come to the hospital, it usually is through a traumatic experience, and most of them end up in the emergency room, emergency department. I know you mentioned about the new agreement. Tell us about what you hope to communicate to patients and families, visitors that come here, about what your goal is for their experience to be when they come through our emergency department.
We very much recognize that the emergency department is the front door of the hospital. And when they enter that front door, we want them to be welcomed as a friend and as a family member, and experience an efficient and high quality and warm experience at a time when it is probably very stressful and a little bit scary. And we want them to feel like they're coming home. And so wherever we can interact with our community outside of the four walls of the hospital, whether it is through volunteer work or health fairs or supporting community events, we want to do that so that when patients do come to the hospital, they might see a familiar face and it might not be quite so scary.
Right. And lastly, as you think about one message you want to give to your staff on behalf of your executive team and the board, to the people who give to the foundation, what is one message you'd like to give to the community?
Thank you.